Hey there, it's Dr. Hodges. I have to tell you, I finally found my selfie stick. So I'm like, yay! So today, as I go on this little jaunt, I kind of want to talk about surgery versus medical weight loss, injectables and all the hype, and who's a good candidate for what, and how to make the best decision for you. So, you know, up until this wave of injectables, really the best medications that we had on the market were for weight loss were phentermine. And unfortunately with phentermine, it's not tolerated well by a lot of people. It's certainly not something that you can use long term. And generally people were losing about 10 to 12% of their excess body weight. So that means if you're about 100 pounds overweight, you're gonna lose about 10 to 20 pounds. And it worked by a mechanism that is almost like a cousin to the amphetamine family. So certainly if you have issues with arrhythmias, heart disease, high blood pressure, that really might not be the best medication for you. And then there are two other medications that came out. There was one that's called Qsymia, which is where they actually paired up phentermine with Topamax to help suppress the appetite. And the phentermine dose was a little bit lower. And they also came up with a medication called Contrave, and that's naltrexone and Wellbutrin, and that works on the reward system of the brain to help you with not just appetite, right, not just to help you with appetite, but also with cravings. And I was actually able to lose, because I took Contrave after doing IVF. I had about 45 excess pounds, and I took Contrave for several years, and it took me about 2 years, 18 months, 2 years, to lose about 45 pounds. And so, and I felt that, but I had to do a lot of work to get there. It wasn't just modifying my diet. I had to do a lot of very consistent exercise. Just what I'm doing right now, going out for a walk. So, and again, for most people, on average, people are losing about 10 to 12% of their weight. So about anywhere from 10 to 25 pounds. Now, whenever all the studies were released, and then the company started marketing Wegovy, and now people are using Mounjaro. Ooh, this is going to be bright. I'm sorry, you guys. Can you tell it's like sun shiny out? These were originally created to be diabetes drugs, and they found that patients would not only did it help them control their hemoglobin A1C, it helped with the fatty acid load. It also would suppress the appetite, and patients were losing closer to about 20% to sometimes up to 30% of their excess body weight. So you'd lose up to 30 pounds. Now, whenever you contrast this with surgery, even with our least effective surgery, and it's still pretty doggone effective, clearly, that's the sleeve gastrectomy, you're gonna lose double the weight. So typically you're gonna lose about 65% of your excess body weight. The gastric bypass is gonna be about 75%, and with a duodenal switch, up to 85%. So that means for every 100 pounds that you're overweight, with a sleeve, you're gonna lose about 65 pounds, with a bypass, 75 pounds, and with a switch, about 85 pounds for every 100 pounds that you're overweight. So clearly, whenever you're looking at what is your overall weight loss, surgery is definitely going to give you double, and with a duodenal switch, almost triple the weight that you would with medical weight loss. So what are we hearing all on the news about? Oh, the medicines, they will, is this going to make surgery become obsolete? And I've had a number of patients come in and ask, like they would really just like to try the medicine. And I'm going to let you in on a little secret. I always feel so bad for my little patients when they come in to talk to me about weight loss. And believe me, nobody comes to see me because I'm the very first person that they think, hey, I know what I'm going to do. I'm going to go call the bariatric surgeon. And maybe they have some good ideas. Surgery is certainly a big step. It's a big decision. It's probably going to be the best decision, because if you're coming to see me and your BMI is 35, you're probably not going to get the results that you want just from medication alone. And mind you, for me, this is what I do. I was 45 pounds overweight, but that took me being in a calorie deficit on an almost daily basis, number one, using medication to help with my appetite and cravings, and then number two, I was going, and y'all know from all these videos, I was going anywhere from 3 to 5 times a week, walking anywhere from 3 to 5 miles a day, so I could continue that deep deficit. Now, how have I maintained that? By continuing to calorie restrict, take medication, and exercise. And so there's not a magic bullet out there that's even for my patients that's undergone surgery. You know, for my surgery patients, they actually seem to respond the best to the injectables. I think the injectables are fantastic, and if I can get those covered for my patients, that always is my go-to if somebody's wanting to move forward with medical weight loss. But whenever I have a patient that comes in to see me and their BMI is 45 or 50, oh my dears, I mean, you might have some initial weight loss, but all the research shows, and then in my clinical experience, I can almost tell you, you're probably gonna regain that weight, because it just takes a lot to, first of all, lose that and then maintain that weight loss. So you really have to be committed to making some significant changes. I had a young patient, and I started them on an injectable, and just like with surgery, just like any other medication, there's going to be potential side effects. And one of the side effects I can tell you is, if you're doing an injectable, it's a selective receptor. What it will do is, if your glucose gets above a certain number, then it kind of kicks in and it'll get that pancreas to start making a bunch of insulin. It also affects fatty acid metabolism in the liver. So what does that mean? If you eat something really sweet or really, really fatty, you're gonna feel lousy. So for instance, I had tried some Wegovy, and I loved it. I think it's fantastic. And it was over Easter time, and of course I ate one of Margie's chocolate Easter bunnies, and we were flying back from Houston. I did not have any Zofran. Oh my God, I was so nauseated. I had the worst dumping from that, and it was just because of my poor eating habits. And it wasn't but a month later that one of my young patients called the office, and she's like, I feel terrible. And you know, one of the initial side effects from the injections is nausea, bloating, constipation, and that hadn't originally been happening to her, but she'd just gone on vacation and she just enjoyed her vacation. She ate like crap for about 7 days, and she was just miserable, and she just didn't know if she should continue on the meds. And so we had to counsel her on her food choices, that, you know, you don't have to take the medicine, but you also need to know that if you are committed to losing weight, you can't eat bad food. We all, I feel like I need to put that little snippet in where whenever you're watching Instagram and somebody says, you know, come on now, you know. Like, we all know that we can't eat every day a great big cup of cream-based soup with extra cheese and bacon on it, and our baked potato soup. We know we can't eat that every day, and it's like 500 to 700 calories, and a gazillion grams of fat. You can't eat that every day and think that you're going to lose weight and have good long-term weight loss. So there's nothing magical about medications, just like there's nothing magical about the surgery. You have to be committed to an overall weight loss program. I've had patients ask me, well, what if I get the surgery? What if I just regain the weight? I'm like, well, is the risk there? Yes. It's more difficult to regain weight, but it can happen. And that's no different than, oh my goodness, you guys, I'll have to figure out what to do with these filters because it's so bright and sunny. It's no different than if you go on a weight loss program with diet and exercise. You can be committed, but if you're only committed for like 4 weeks or 6 weeks, and then you kind of fall back into old habits, that does two things. Number one, that does a number on your metabolism in a negative way. But then number two, it's just ensuring that you're not going to have good long-term weight loss. And so, how do I sum all this up? I think whenever you are wanting to lose weight, I want you to be realistic, number one, about your weight loss goals. If you are not 6 foot, then you should not be over 200 pounds. I'm just telling you that right now. And I have a lot of people that come to see me, 250, 350 pounds, and they tell me that they just want to lose. Dr. Hodges, I'm going to be good. I just need to lose about 20, 40, maybe 50 pounds. Nobody should be over 300 pounds. That's number one. And really, if you're under 6 foot, you shouldn't be over 250 pounds either. I'm not trying to get you into Sports Illustrated at all. Every one of my patients can attest to that. But what I am trying to do is I want you to feel better. Not just on the outside, but on the inside. I want you, oh my gosh, this is so bad, this bright light. I want your diabetes to go away. I want your high blood pressure to go away. I want you to have a longer life. You know, when you have a BMI over 40, you have the same life expectancy as somebody that's been smoking a pack a day for 20 years. I mean, come on. You are worth it. And so don't shortchange yourself. And it's okay if it's scary. And another thing that I'll end up doing sometimes is I'll start people off on medical weight loss, and we can reassess after 90 days to see how they're doing. And to let them know, like, hey, these are some of the changes that you're going to need to be making to make sure that this is something long-term and it's not just some fad diet that you're chasing. We want you to be healthy and happy. So sit down, kind of see what your goals are, look at what your current weight is, and then also look and see what your current health problems are, so that you can see all the benefits, even just from what moderate weight loss can offer you. So I kind of hope that this helped. Either way, as I will tell my patients, the only thing you have to lose is weight. So you can't go wrong with doing medical versus surgery. However, I want you to be realistic about your goals. We can all go on Instagram and TikTok, and we can all see, you remember whenever keto first came out and people are like, I lost 70 pounds. That was what, 2, 3, 4 years ago? I would love to see where those patients are right now. Because unfortunately with medical weight loss, the recidivism rate, meaning the risk for weight regain, is about 98%. So you're going to have to be committed regardless of how you get there. You're gonna have to make these changes. So I hope that this helped. Y'all get on out there. It just takes the first step. And have a good summer.